Activated oxygen is a gas that has been used clinically since the mid-19th century. The potential for improving the human condition for diseases and infection application is being developed and studied for its safety and efficacy. This presentation will cover the chemistry of ozone, safe application for home use, and examples for many conditions. So, what is ozone, and is it useful? Ozone is a naturally occurring gas. Our planet is surrounded by an ozone layer which protects us from the harmful radiation above our atmosphere. In 1896, Nikola Tesla patented an ozone generator that was used by doctors to treat bacterial infections. They found that not only did ozone treat infections, but it also had an anti-inflammatory benefit. Since then, ozone has been used to treat HIV, Ebola virus, staph infections, and used in several applications where antibacterial effects were needed. While it has been shown, as stated in the Journal of Natural Science, Biology, and Medicine, that the mechanism of action causes an inactivation of bacteria, viruses, fungi, yeast, and protozoa, there remains concern for its widespread use. Because of this, it is recommended that a person seeks medical advice for any health issues. The details in this presentation are to be considered as a source of information only and is not intended to diagnose or treat any disease or. The Center for Disease Control issues this chart of various exposures to ozone and any hazards, and prevention of any hazards in the event of exposure. We can see here the table advises plenty of fresh air, breathing protection, and shielding of the eyes when ozone is present. Ozone does destroy the cell wall of the microorganisms that cause disease. However, it does not appear to destroy the healthy tissue of a human subject when applied appropriately. Ozone has many benefits to creating a sanitary environment, energizing the cells to metabolize better and heal fast, whiten teeth, and improve overall health. As an example of how a bacterial cell wall is destroyed, the latex glove represents a component of the cell wall. These latex gloves and the outer wall of germs contains a polysaccharide. Exposure to the ozone gas, also known as O3, onto the body surfaces will kill the germs. With viruses, the O3 damages the cell wall and upsets the reproduction of the virus, rendering it ineffective to the host. Applying ozone to the body can be achieved in. Ozone gas can be mixed with or in the blood by syringe, applied directly to the skin via a tube, bubbled in water to be applied to the skin or swallowed, and as an oil to be rubbed on to the lesion or the skin. Oil becomes an ozonoid, which traps the ozone within the oil to bring greater stability to this gas that would otherwise decompose in the air in minutes to hours. Next, we will see how several methods of application to the body can be. Besides making ozone water with chilled water and an aquarium bubbler, ozonoid oil can be made as well. Put 2 quarts of sunflower oil into a tall glass container and bubble ozone into the oil 24 hours a day for 9 days or until the ozonoid thickens in the tubing. Pour into glass containers or dropper bottles. Refrigeration is not needed for the oils as they hold the ozone stability for much longer than the water. Interestingly, it has been told that this was found in Cleopatra's tomb, full strength and therapy. Not sure how the ozonoid oil was made in Cleopatra's time. Technology now provides us with relatively inexpensive ozone generators that can be purchased in many countries. Amazon carries a few generators that can be compared for home use. Other accessories will be needed to create delivery systems for different applications. Wands and connectors can be used to make the delivery of ozone easier. In some cases, using a plastic bag over a body part is useful. Now we will demonstrate some dental, eye, and skin exposures of ozone. Disposable stethoscopes work well to deliver the ozone gas into the ears for ear and sinus problems. Using a small piece of damp tissue will help prevent the drying effects of ozone when applied to the tips of the stethoscope. Tubing can be directed at various places throughout the body to deliver it locally in a problem area. To do this, place a large plastic bag on a chair to protect the furniture, hold the delivery tube in place with tape if needed, and place a warm, wet washcloth over the tube to humidify the ozone gas. The person can sit directly on the tube in white shorts in order to get the ozone into the affected area. White clothing is recommended because the ozone will have bleaching effects on some fabrics. Dr. William Dome, a dentist in California, has taught many dental professionals all over the world to intervene in dental problems through ozone application both in the office and safely at home. This woman self-treated her teeth for 5 20-minute sessions over a month's time and followed with 20-minute self-treatment every 3 to 4 weeks with no recurring pain or discomfort. Research presented showed that decay can occur under composite fillings in 4 to 5 years if the prepped tooth is not ozonated before inserting the composite filling. Ozoning after the fillings are in place is an excellent way to preserve these restorations. Self-treatment at home gives the best results. The patient is instructed to hold the ozone delivery tube firmly over each tooth for 15 to 30 seconds. Severe gum recession where the attached gum has been destroyed is a difficult problem in dentistry, usually treated with a surgical procedure. 5 10-minute treatments will stimulate normal tissue growth. This lady had the jawbone regrow around the roots of the tooth, which resulted in strong teeth that were no longer in danger of dying or falling out. In the follow-up picture on the right, the gum is a healthier pink color, the receding gums are healing, and the teeth are not loose in the bone. Another mouth problem that can be helped with ozone is called a fistula. The fistula above tooth number 4 on the left can be resolved with an adequate number of home treatments of ozone. Dr. Sylvia Menendez points out that chronic, long-standing conditions will have to be retreated. In the picture on the right, the cavitation in the bone around tooth number 9 was greatly improved in 3 30-minute self-treatments. Continued home care will be required. In many of these cases, the black gum, where the tissue is damaged or dying, completely resolves. Ozone helps to desensitize the teeth and to make the dental hygiene appointments more comfortable. An experienced periodontal hygienist can resolve this advanced gum disease in a week of daily scaling and ozone therapy. Ozone enables the tissue to heal quite quickly. One of the benefits is that the person will no longer have teeth that are sensitive to hot and cold temperatures. The dentist wanted to extract this tooth. The patient was taught to gently brush and massage this area and expose it 5 minutes per day using the Anali Home Ozone unit. A dentist told this person that all of the teeth should be extracted with her current infection and that the black could not be removed from her tongue. 5 40-minute sessions later, 1 week apart, the teeth were solid, no longer loose, and the black stain was nearly gone. Continued home care is needed, and the patient is happy to do the work in order to save her teeth. Alternate to using the ozone gas in the mouth, a drop of ozonated sunflower oil on the toothbrush along with peppermint oil or toothpaste will help keep the mouth germ-free. This is a great alternative for those who cannot purchase an ozone generator for home use. Besides a healthier, restored smile, other uses for ozone are beneficial. Because ozone will sting and burn the delicate eye tissue, it is recommended to only apply ozonated water directly or with a moist paper towel. Never use ozone gas directly on the eye. As a reminder, dental applications of ozone as a gas or oil are safe. When exposed to ozone gas, the microcirculation of the body, the capillaries, will absorb the gas across the skin's membrane. Given enough exposure time, a suitable amount of ozone can do its work in the body. This method is not as direct as putting it into the body with a syringe, but it certainly works for people. To apply this method, place a large plastic bag on a comfortable chair or couch, place the ozone delivery tube on the center of the chair, then place a warm, moist cloth over the delivery tube. Sit in minimal clothing as long as possible, as often as possible. This appears to reserve many chronic conditions. 8-year-old Reed, who contracted lice for the 3rd time at his school, he self-treated with his mother's supervision for 90 minutes and has not had a lice problem in the following year and a half. It is important to cover all of the hair and use tape to secure the plastic cap to the scalp. A fan is positioned to blow the ozone gas away from the face so the gas is not inhaled. Inhaling the gas can cause a temporary, mild bronchial cough. If coughing occurs, using vitamin C orally can help resolve the cough more rapidly. Ozone bagging makes stiff joints more flexible and reduces pain. A plastic bag, the ozone delivery tube, and time is all it takes to heal a variety of foot problems. The ozone gas crosses through the skin and into the circulation immediately surrounding the area that is exposed. In a medical ozone office, the doctor may choose to inject ozone into an inflamed or injured joint to accelerate healing and decrease inflammation. Dr. Frank Schallenberger of Carson City, Nevada, teaches medical professionals the injectable version of ozone therapy all over the world. He is considered the father of modern ozone therapy. The potential for joint rehabilitation is one of ozone's greatest rewards. Remember, ozone breaks down rapidly and offers concentrated oxygen to the tissues for healing. This woman placed her hand in a plastic bag with the ozone delivery tube for 30 minutes and noticed that her hand felt more supple. She continued this treatment at home. Her other treatment alternative might include the surgeon cutting her tendons to relieve the shortened, tightened tissue. This example shows that even when obesity, diabetes, poor quality diet are present, a person can still succeed using ozone for 30 minutes daily for several months in a row. There are a lot of opportunities to gently suggest additional lifestyle modifications to help people turn their health around. People can see the normal color return to their legs with diligent application. Face down while she received massage therapy, this woman's nail fungus is being doused with ozone gas. It takes no less than 2 months of 2 30-minute treatments per week to have a positive effect of the deeply invasive nail fungus. Toe fungus takes several months to realize success because the nails grow so slowly. An excerpt from Dr. Altman's book, page 151, states, "Researchers concluded that this study demonstrated the fungicidal power of ozonated oil and recommended it as superior to conventional treatments." This 90-year-old woman was sent home after a month in the hospital with non-healing wounds. You could have stacked 3 quarters inside the initial wound, it was so big. Not only that, she had the same problem on the other ankle. The family was instructed in wound care and felt frustrated about getting nowhere and afraid that infection would take her life. They began using a bag around the feet with the ozone generator 3 times a week, and the wound gradually closed to the family's delight. You can see how much better this is 4 months later. In a medical ozone office, the doctor might choose to inject ozone under the skin surrounding the lesion, which would provide a more rapid progression. This man self-treated with ozone, and after 4 30-minute treatments, his skin condition resolved. He put a hole in the bottom of a paper Dixie cup and put the tip of the lure in the hole to deliver concentrated ozone to the skin condition. He used a fan to blow excess ozone away from his face. Warts are a common skin problem caused by a virus, which ozone kills. Warts, patches of rough skin, and painful flea or spider bites can also be addressed this way. Dr. Ed Lynch recommends children's teeth be treated with ozone 3 times a year for 15 seconds per tooth. This effectively kills the biofilm that the bacteria have created in the mouth. Once the biofilm is removed, the bacteria do not completely reestablish for 2 to 3 months. This is a non-invasive home therapy to help your kids prevent tooth decay. Here, an enthusiastic patient is ozoning his teeth and using a fan to blow away excess gas while having a detox foot bath. Not surprisingly, pets of all kinds can benefit from ozone. Although we do not see any suggestions for birds or reptiles, dogs, cats, and horses can easily have an ozone application. All you need to do is bag the involved portion of the body as often as possible and as long as possible. The pit bull needs to be calmed with massage, and then the owner places the ozone wand on the molars for as long as possible. Yes, occasionally the dog coughs. It isn't necessary to anesthetize the pet to clean the teeth with ozone. Ozone adequately kills the germs, stops gum infections, and hardens the teeth, just as we see in humans. Dermatological conditions resolve quickly. And when Kitty got into a cat fight and was bitten on the tail, the owner was worried about infection. 20 minutes of ozone and the tail stood up and no infection ever followed. Remember that only your veterinarian can diagnose and treat animal conditions, so be sure to consult with your pet's doctor as needed. Many veterinarians are skilled at applying ozone to animals both externally and intravenously. Beyond humans and pets, there are other applications for ozone. Ozone are numerous. Commercial applications are also expansive. Hospitals, buildings, and cars are some of the other applications for ozone treatment. Most importantly, having a comfortable area that has good airflow is essential to safely use the ozone gas. This family created a lovely setting with fresh air, light, and ambiance for healing. These references are but a few that support the safe use of ozone therapy for many human conditions. Thank you for your attention during this presentation. I hope that you will continue to explore the possibilities of ozone to improve